What causes blood pressure to rise? If you are like most people, the first thing that comes to your mind is salt. But what if some of the things quietly pushing your blood pressure higher have little to do with the salt shaker at all? In fact, certain everyday habits and seemingly harmless routines may be putting extra strain on your blood vessels without you realizing it. Today, we will uncover 5 unexpected things that can raise your blood pressure, and one of them is something many people do almost every day. Many people focus on obvious causes like salt, processed foods, or lack of exercise. But what's often missed is that some blood pressure triggers are much easier to overlook. And because they often feel harmless, they can quietly become part of your daily routine. Let's start with the first unexpected factor. Number 1, poor sleep quality. Most times, people think blood pressure problems are only about what you eat or how active you are during the day. But sleep plays a much bigger role than most people realize. The key issue isn't just sleeping few hours, it's poor quality sleep. This means you might be in your bed for 7 or 8 hours, but your body is not actually getting the deep restorative sleep it needs. When this happens, your nervous system stays slightly switched on, even at night. And over time, that constant low-level stress response can push your blood pressure higher without obvious symptoms. But here is something even more interesting. Poor sleep is often not the real problem on its own. It can actually be a sign that something else is disturbing your body at night. And that brings us to the next factor. Number 2, certain pain relievers. This is one many people don't expect. Some over-the-counter pain medications, when used regularly, may influence blood pressure levels over time. Not because they are dangerous in short-term use, but because frequent use can affect how the kidneys handle salt and fluid balance in the body. And when that balance shifts, blood pressure can gradually creep upward. What makes this tricky is that most people don't connect pain relief with heart health at all. But your body doesn't separate systems the way we do mentally. One system affects another. And speaking of things people don't connect with blood pressure, let's go to number 3. Loneliness and social isolation. This one surprises people a lot. Blood pressure is not only influenced by physical habits, but also by emotional and social connections. When someone feels consistently isolated or disconnected, the body can stay in a subtle stress state for longer periods. And this can influence hormones linked to blood vessels tightening and heart workload. The problem is, this isn't the kind of stress people always recognize. There's no obvious alarm, no obvious symptoms. Just a quiet internal pressure that builds over time. But here is where things get even more interesting, because some of the biggest triggers don't happen during the day at all. They happen at night. Number 4, hidden sodium in packed and restaurant foods. Most people assume they already know about salt and blood pressure. But the real issue is not the salt you can see, it's the salt you don't see. Packaged foods, sauces, fast foods, and even meals that taste normal can contain surprisingly high levels of sodium. And because it doesn't taste overly salty, people often consume far more than they realize. This slow build-up can quietly influence blood pressure over time without any immediate warning signs. And that is exactly why it goes unnoticed for so long. But the final factor is the one that ties many of these issues together. And most people have no idea they even have it. Number 5, untreated sleep apnea. This is one of the most overlooked causes of rising blood pressure. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. The dangerous part is that many people don't even know they have it. Each time breathing pauses, oxygen levels drop slightly, and the body reacts by activating a stress response. Over time, this repeated cycle can put significant strain on the cardiovascular system. What makes it more concerning is that it often goes unnoticed for years. People may just think they are bad sleepers or always tired, but in reality, something deeper may be happening during the night. The important thing to understand is this: blood pressure doesn't usually rise because of one dramatic cause. It builds slowly through repeated, often unnoticed influences. That is why identifying these hidden triggers early matters more than most people realize. If you found this helpful, consider subscribing, because in the next video, we will break down something even more overlooked. We will be looking at the morning habits cardiologists want you to stop. And what you will discover might surprise you, because it's something millions of people do immediately after waking up without realizing the long-term effect it may have on their heart health. So make sure you don't miss that. And if you want more videos like this, you already know what to do.